OldGuyTalks.com is all about being a better man. Join me on this kick-ass journey. Exclusive stuff for members only in the Old Guy Cave. Opt in now. Questions. That's right. This is Oris, the Old Guy from www.oldguytalks.com. Here with Dr. Carmen Mora, my doctor. She can't say that, but I can because I'm not worried about HIPAA. And I know she is very, very interested in it. And so the old guy is here to talk with her about platelet-rich plasma and its therapeutic uses. And the old guy had recently had a shot. Tomorrow will be 2 weeks, and we can talk about this as we get into it, especially when we get into this section about using it to treat injuries. But before I do that, two things. First of all, if you have not already opted in, do so now. When you do, I will send you my 3 ways, count of 3 ways, how to be appreciated more by your queen at home without begging. And you know what I mean about being appreciated. That's right. I think we all know about that. So do that, and 2 of them are for free. One costs less than $10, and they're all easy to do. And there are big dividends to doing them. Also, I need to read this little disclaimer that Sue, the lawyer IP babe, has me read every time we do a medical segment. This is not the way that she would have written it, but she says this will work well enough. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You're responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. You can rest assured the old guy only promotes stuff he uses. You let me strike that word may. You will have different results because none of us have the same results on anything. So that's it. That's all. Now we got all the legalese stuff and everything else past us here. And Dr. Mora, tell us a little bit about yourself and your background and how you got into this really interesting space in health and anti-aging and how to keep people healthy versus the disease model.
I'm very, very passionate about working with PRP. That's one of the top modalities I do. I do a lot what we call regenerative medicine. My specialty is whatever we can do to kind of reverse the aging process. What I want to talk today more is about PRP. So it's platelet-rich plasma. It was about like in the 70s when hematologists really started finding out about PRP and the whole function of the platelets. It wasn't until like the late 90s, kind of more started with dentists and vets kind of using PRP, and then it got more mainstream. Now, a lot of physicians are using PRP. Even a lot of orthopedic surgeons are adding PRP. We're also adding biological allografts, autologous allografts. I'll go more into that in a bit. But going back with the PRP, what we found is if we get a big concentration of the platelets and we can inject it in certain areas, we're literally regenerating and repairing tissue. So, for example, tendonitis, torn ligaments. I can go in and do a couple treatments, and we're getting full repairs without having to go in and do surgery. That's one of my top things I love working with. Anywhere you can think of where we can inject, I've injected PRP there. Mm-hmm. So we can do a lot of facial stuff. I do a lot of aesthetics. Vampire Facials is called, Vampire Bracelets. I've done the Prp shot where we're injecting the penis with PRP. I've done the O shot where I'm actually injecting the clitoris and the vagina. Very, very popular. I think I do about 5 Prp shots a week. I do maybe 10 a week of the O shots. So they're very popular, becoming more mainstream. We're getting really, really good results. I mean, literally what I'm trying to do is just reverse the whole aging process.
Sure. Well, tell us a little bit. Our listeners would like to know a little bit about you. What's your background, and how'd you end up becoming a naturopathic physician and all that and that stuff? So tell us a little bit about you.
So about me, I'm a naturopath. So I graduated out here in Arizona, the Southwest College of Naturopathic Medicine. Really, really great school. I feel fortunate to have gone there. Um, I originally started with a degree in finance, and I used to be a bank manager for a while. It really wasn't for me. I kind of really thought about, kind of think about just doing 60, 70 hours a week and kind of just working for somebody else. It wasn't a job where I felt coming home, I felt very proud. I want to do something where I can make a big difference. That's when I started looking more into medical schools, and naturopath medical school really got more to me because it's kind of like finding the root cause of an issue. It's not just here's a prescription for this. While I started going to school, I really started learning about regenerative therapies. You know, I work a lot with medical ozone. I do a lot of, biological allografts, PRP, and I'm really passionate about it. Not only do I have my own practice, but I also work for another company where I'm educating physicians. So every month I'm going around and teaching physicians how to work with PRP, how to work with medical ozone and biological allografts. Right now it's my biggest thing. You know, I think next month I'll be in Georgia teaching physicians there, and then I'm back in Phoenix, and then I'll be in Washington. So every month I'm traveling around. I have a lot of doctors that come. I close my office on Fridays because Friday's the day I spend teaching doctors how to do these type of injections with PRP. I don't know. I like it a lot. It's my thing. What have you noticed, Doris, when you come in?
Okay. Well, it's tomorrow will be 2 weeks, and I've had a injury, which is a really, I'll tell you, I would take a broken bone, I would take a lot of other things over this thing, but I had a small tear in my bicep tendon. And some of you that have been following me on Facebook and on my website have heard me whining about it. And it's one of those things that was easily re-injured. You could like reach for something real fast, or just or you think that it is done and it's not done. And it's been over a year that I've been doing this. I went to a physical therapist, actually excellent physical therapist. Actually, this one, he has people actually literally fly in from around the world to do physical therapy from him. And the other, when he's not there, he could be at the French Open, tennis Open, or deals with pitchers from baseball and this and that, professional players. So he's very excellent. But I never really got it healed completely. Never got it to where I could get back into the gym and start doing the activities I normally would be able to. And I will tell you that when I had the injection 2 weeks ago, it was a very different experience. You could, I don't know if, sometimes your mind plays tricks on you, and who knows what the hell's going on in your mind, especially my mind. My wife tells me that all the time. It is that I could actually feel the changes going on, and it progressively got better and better. And it's not like overnight, but I feel that like in 2 weeks I've really gotten a lot better, and that I'm actually feeling like I could probably start slowly easing into my aggressive workout program. And I never really felt this way until actually you gave me the injection a couple of weeks ago. So it was a really a big thing, and I'm looking forward to seeing this progress on. So
Nice.
so that yeah. So tell us a little bit about the process of how do you make the PRP? What goes into that?
The first thing is your blood. So what we're doing is we're getting a couple of vials of blood. There's so many companies out there right now because it's becoming so popular. We call it PRP kits.
Mm-hmm.
So they're going to have kits, and the most important thing is having anticoagulants. So there's different types of anticoagulants we can have in the kit. So we're using a special centrifuge, which is called a Prp Centrifuge. It can't be just any regular centrifuge because we need to have it, we call like at a 90-degree angle. That does a better platelet separation. Also, with the anticoagulant in it, when we're done centrifuging it, we have all like the red blood cells in one section. We have anticoagulant, and then the other section will be all our PRP. Also in that section, it's something called PPP, which is platelet poor plasma. We don't use that at all. We're just using just a small amount, about 2 cc's of the PRP. That's going to have, typically, it's going to be 7 to 10 times platelet concentration. So it's a really good amount of platelets. That's what's going to cause the healing process. When I'm going in, I'm injecting that into certain areas. What it does is we call it, it's like a cytokine cascade. These are special messenger cells in the body that are calling stem cells to come in, your platelets to come in, everything to start the healing process. The body sees a huge amount in one area, and this whole cytokine cascade starts. So everything is coming to the area. For example, when you had the treatment, did you feel a little bit sore for like the first 2 days in the area injected? That's typically because it gets a little bit inflamed. You know, you have all these cells working in there. So it's like I'm causing inflammation on purpose, but it's good inflammation. You know, everything's going in there to start working. Within a couple of days, typically 4 to 5 days, that's when the patient feels like, wow, you know, I'm having better movement. I can start to notice a difference. The true healing process typically starts 21 days. And we call that like a cellular matrix. That's when all the cells really start getting together, and we're really having regeneration of tissue. But typically in 2 weeks, it's, you know, when I say, hey, come back into the office, let's sit down, talk, I want to see what your results are, because you start seeing the healing process. It's not going to be 100%, but the healing process has started. So that's one of the top things with PRP.
Yeah, I mean, as I mentioned, my experience is actually I'm really starting to notice kind of a snowball effect on the healing process that's
And in a
occurring.
couple of weeks, it's going to feel even better. What?
Yeah. So I'm looking forward to it. You know, there's some people may listening to this. I've been told I'm kind of far out on some of this stuff, but I'm not. But you know, I think a lot of times you can take your cues from in this area. You may take some of your cues from professional athletes that have done this, because I mean, from Kobe Bryant to Grant Hill to lots of professional athletes that are trying to extend their professional career, and you can be sure that they've done their research before they ever did that. There's lots of famous athletes.
Well, I believe Kobe went to Germany to get it done originally because it wasn't real popular in the United States back then.
Exactly. Yeah. So he went out of the country, and but now it's actually being more and more used by their doctors. So, what is the critical training that someone needs to be able to administer this properly? And you mentioned earlier that you trained other doctors to do that. So what's the training that's involved? And if somebody is obviously somebody may not be in this area, and they not be able to come to your office, and we're going to provide that information later on. But what training is needed?
I would say a lot of training. I've done lots and lots of training. Technology is always changing, the information, the latest information. Even on PRP, we're always getting new research, new data coming out. Before, they always thought, you know, higher concentration of platelets was better. Now we're finding out, no, it's not true. It's, you know, 7 to 10 times is the goal we're shooting for. When I'm teaching physicians, you know, half the time we're sitting down and I'm kind of teaching them the mechanism of action. You know, we call it the didactic part. Also teaching them hands-on how to do the injections, you know, where to inject, the proper ratios. Typically, if somebody's going to see a physician that's doing PRP, you really want to find out, make sure that they're certified. You know, certified to do PRP. It's not required, but that's something you kind of want to know, is like, wow, did they go through the whole certification process? Do they really understand the whole mechanism of how this is working? And do they know where to inject exactly? You know, having a good background in that. I would probably say, You know, when I'm doing the trainings, you know, it's 12 hours that you want to have at least minimum. This says, you know what, I've been doing PRP for 12 hours, hands-on. I did all the book work stuff. I'm understanding the whole concept. Other than somebody saying, well, you know, I watched some videos or I saw another doctor just do it.
Mm-hmm. Yeah, it's definitely something you want to have people understand what they're doing, because I'm sure it's very technique sensitive in terms of what you're doing. So let's get into some specific uses. Facelift, fillers, and the famous vampire facelift. That let's talk about that. That's a total marketing name, the vampire facelift. Who doesn't want to get that?
That is a really popular procedure I do. And I'll be honest, I do that to myself. I do the vampire facelift once a year. I'm in my mid-40s. I feel I have really great skin. I don't have to do all these other procedures, which I do a lot of other stuff too. You know, I do the Juvederm, fillers, Botox. I offer all those modalities here in my office. But hands down, the most popular is going to be the vampire facelift. And I'm going in and I'm injecting PRP into the face just as if it was a filler. The great thing about that is PRP has over 7 different growth factors. It's one of the top things needed for collagen growth. You know, I'm going in and injecting the face. You're literally seeing it within days how healthy your skin is looking. Months can go by and you're still reaping the benefits of it because it's literally reversing the aging process. It's a big difference than we're doing it with just going in with Juvederm. You know, you're going with Juvederm, Restylane, they're synthetic fillers. Yeah, you're getting
so explain a little bit more about what those are. Explain a little.
So, for example, like Juvederm is the most popular filler. We call that hyaluronic acid. It's synthetic, but it's a filler. You can put it in, you know, let's say most common place is a nasolabial folds. We'll put it in there, instant results. You know, it's filled, it looks great. Depending on the person's metabolism, it typically lasts about a year. And then the body starts breaking it down and then it goes back to the way you had it. The difference with PRP is going in there and it's building collagen growth. So within a year, it actually should look better. But it's a slower process. It's not going to be immediate filler results like Juvederm does. You know, we're literally growing collagen again. When we call it a true vampire facelift, what we're doing is we're adding Juvederm and adding the PRP. So both of those are being put in the face. So you're getting the instant results of a filler, but then you have the PRP on top of it. So when your body starts breaking down the Juvederm, your body's making new collagen with the PRP. That's why it's such a popular treatment versus just doing PRP or just doing Juvederm. Because you're getting both worlds. You know, you're getting instant results, and then you're literally getting collagen growth. So that's what makes it very, very popular.
Yeah. Now, you know, I gotta say that some of these treatments that you see people get, some of the Botox and some of the facelift. I mean, I got to tell you, I see people, especially here in Scottsdale, they look like they just saw the taxidermist. I mean, that's like that. You know, I mean, it's just really, it's really, they're almost like
But I'll tell you, a lot of those people by choice, they want that look. I get a lot of patients that they're like, I don't want any movement. I don't want any movement. I want it frozen. And that's by some people. So it doesn't always have to look like that. I try to go more natural look when I'm doing Botox on my patients, and that, you know, so they can. I always ask them to, like, do you want a little bit of movement? Do you want to be able to have an expression? But I'll tell you I get a lot of patients like, I don't want it to move at all. Just freeze it. So.
That taxidermist look. I mean, it's either, you know, it's either the taxidermist or the embalmer. But I mean, it's like it's not a good. I just like, you go like, wow. I hope you didn't pay a lot for that. But I guess I'm surprised that people. Yeah, we actually have a friend of ours who's a facial surgeon, and when he does actually does facelifts, he does a great job because you can't tell he did them. I mean, you can tell, but you can't tell. It's just kind of like you look really different, but that's a whole nother story. So let's talk about hair regrowth and what's the deal there with PRP?
You know, really good results with PRP for hair regrowth. Works really good for men and women. What I highly recommend is somebody's going to go in there and get PRP for hair regrowth, do a hormone lab first. There's one particular hormone, it's called dihydrotestosterone, DHT for short. If somebody has that hormone high, female or male, that's what's going to cause #1 reason for hair loss.
Mm-hmm.
We can go in, do PRP injections in there, stimulate hair growth. But if that hormone stays high, we're going to go back and start having the hair loss again. So before I do any of those treatments, I always want to look at those labs, kind of make sure those DHT levels are normal, not too high. If they're too high, then we do things to correct that. But let's say everything comes back normal. What we do is, let's say a typical procedure is the person will come in and we'll apply like numbing cream on the scalp. So we'll let it kind of numb a bit. Because what we're going in is I'm going in and actually doing injections with PRP. So it's PRP, and I'm also adding a couple of vitamins in there to kind of help stimulate. Takes about 4 treatments, and then we separate them like every 6 weeks because your hair cycles grow, you know, in 6-week cycles. We kind of call it different cycles. Really good results. You start seeing it within 4 weeks. You start seeing kind of like call it like little fuzz. You start seeing the hair start growing out. So I would say of all my treatments, it's a little bit painful because we are injecting it directly into the scalp. Even though we're adding numbing cream, you can still kind of feel it a bit, you know. So I always kind of say some of my patients feel a bit like a Tourette syndrome when we do it.
So is there a, what can somebody reasonably expect in terms of, depending on how bald they are versus to the end result? What's a reasonable expectation?
If somebody comes in and we're talking and I'm seeing that shiny forehead, no hair follicles.
Right here. We're talking about me.
You do have a couple hair follicles back there I can work with. I see those. We can kind of stimulate, but you know, if we're talking right here, which really shiny, I mean, really honestly, you're not going to get the best results. I've only had like 2 people where they're like, go ahead, do it. And we have had hair growth. But that's something I try to be very honest and be like, you know, I can't promise anything. We're not going to get the best results. But if you have like you have up there, you have a couple hair follicles still, we can definitely continue stimulating. And with PRP, you get really good results.
Well, those were placed up there a long time ago. They're not naturally occurring in that area. That was one of the things that was really kind of surprising, was that you could use PRP for hair regrowth. And typically, is that you said it takes about 4 treatments? Is there a maintenance phase to the hair regrowth, or is that like your kind of 4 and done, or
Well, we always say like every year you want to go back in for a touch up. You know, you got to think about too, no matter what, you're still aging. You know, you always want to keep checking those hormone levels, make sure that they're not going up. But after your initial 4 treatments, what's recommended is just come once a year and we'll just touch up, you know, and then we'll check those labs to just make sure they're not going up too high.
All right. So I'm going to switch gears here on joints and tendons and all that good stuff. Where do you think PRP is useful to treat joints and tendons and muscle injuries? And when do you add other additional components to the therapy? Where do you bring up? And I have to, just for our audience sake, I have a couple of friends that have gone to see Dr. Mora, and they just speak highly about her in regards to this area. because they had some knee issues that she was able to deal with very, very successfully. So
So when I
they're
started
happy
working with,
campers.
yeah, when I started working with PRP, that's the first thing I started doing. That's what I originally got into, was pain management, regenerating ligaments, tendons. When somebody comes in for a consult on it, what I really do like seeing is I kind of want to see imaging and kind of see, okay, what are we working with? What's the damage? Where's going to be my target locations I'm going for? Because to be honest, there's some cases that I'm going to be like, there's nothing we can do. We have a lot of osteoporosis, disc degeneration, when it's dealing more with bones. But if we're talking about ligament damage, tendon damage, muscle damage, um, we are getting such great results with PRP. That's one of these PRPs really, I mean, you can go into PubMed and you will see literally thousands of published articles talking about how it helps repair these issues. But I do like looking at imaging so I can kind of know what the background is, what am I looking at. Not only that, but it's great after we're done with our treatment, a couple months down the line, let's do imaging again so now we can compare and we can see the improvement. So I kind of like doing that baseline. Depending on the extent, I offer different modalities with the PRP. If it's really, really bad and we're trying to get the best results, that's when I add in biological allografts. The
Okay.
biological allografts I use, we can get them from umbilical cord or amniotic tissue.
Okay.
They say those allografts, and in general, like the public kind of calls it like stem cells. That's like the term, but the correct term is we're using is biological allografts. They say for using those, research shows those cells are replicating about 200,000 times. If you look at somebody in their 40s, I mean, those cells are not replicating that much. Research is showing probably 2,000 times. So we're getting a higher replication of very potent cells. That their main job is to regenerate tissue and create tissue. If I'm injecting biological allografts, let's say, torn, partial tear ligament, we're getting a faster response. Typically in 3 months, I have a 90% success rate using biological allografts. In 3 months, I mean, we're getting amazing results. People that couldn't go golfing anymore can go golfing again. My big thing when I'm doing it is I have to tell my patients, like, don't go overboard. Don't go hiking too much. Don't, let it repair, because you start feeling so good. You want to do everything like you're in your 20s again. If it's not such bad damage, that's when I just go in and just do PRP. If it's very, very light, there's another modality, medical ozone. People that don't really know about it, you can kind of search, it's called ozonotherapy, prolozone are other terms used for it. I typically like doing a combo of all of them to get the best results. So I'll go in, I'll inject the area with a little bit of Procaine, that's like an anesthesia, and then I'll go in and inject platelet-rich plasma, the PRP, I'll inject some ozone, and I'll inject the biological allografts all in one sitting. Typically one treatment of those, I'm getting really, really great results. It's a little bit costly to use biological allografts, and if it's not such bad damage, I just pretty much just do the PRP with the medical ozone. If it's really light, I'll just go in and do prolozone, just going in with the ozone. There's so many different modalities you can use to regenerate, and this is what I really started getting into. Then I started seeing all the great benefits of PRP, and literally I inject it everywhere you can think of.
Yes, you
we'll
do.
Talk about that in your man cave session.
That's right, folks. So we're here. We've done talking about facelift. We've done talking about hair regrowth. We talked about joints, tendons, and muscle injuries and all your aches and pains. But the old guy has a new feature. Well, it's not up yet, but when you're listening to it, it may be up yet. We have a special section called the Old Man Cave, where we have special content. It's a member-only area, and you can get it by signing in. And what Dr. Mora and I will be doing is going into secret sessions, so secret that the NSA does not know where we are. We will have our tinfoil hats on, so we are not detectable. And so we're all ready for the secret session. But before I do that, Carmen, when I have my guests on, we talk about virtues like, getting healthy and things like that. But I always like to ask my guests about their vices. Yes, that's the reaction I usually get from people. So, so if you were to compete in an Olympic event, summer or winter, what would it be?
Summer.
What event would it be?
What summer
What event?
I would probably say swimming.
Okay. Any particular thing that you like to swim? Any particular event? No. Okay. So, and what kind of music do you listen to?
I listen a lot to lounge. We call it house lounge music.
What is that? I've never heard that term. It's
really.
Yeah.
One of my really, really good friends actually owns a nightclub in downtown Phoenix called Bar Smith, and every weekend they play house lounge music.
Okay.
So
Okay.
if you're ever around to go see it,
we'll have to.
I'll send you some music.
Okay, I'd love to. I'd love to do that. Yeah. And maybe we'll put a link on that.
You know what? When you were in my my exam room, the music I had playing, that was house lounge.
Okay. All right. So I'll have to do that. So I'll ask you because guys, do you smoke cigars? No. Oh my gosh.
You do.
I do. The old guy does. And actually, you know what? Normally I'm having a cigar during the interview, but folks, the old guy had a dental implant done Monday, and it's probably not a good idea to have a cigar like within a few days afterwards. So I'm taking a few weeks off, and believe me, it's killing me to do so because normally I do have a few cigars a week. Do you like to drink alcohol?
Yeah.
All right. Anything in particular you like to drink?
Wine. So typically more like a Sauvignon Blanc.
That's what I got. Little tartness, either apricot or grapefruit taste to it. Those are my favorites too. So if you are eating something in the closet that you don't want anybody to know that you're eating, what is it that you're eating?
Oh my goodness. It would be cheesecake.
Cheesecake. All right.
It would be cheesecake. Too bad.
Does it have a topping on it?
Strawberries.
Strawberries. Okay. All right. That's not too bad.
It's funny though, because in my office, I do a lot of weight loss consultations here too. So I don't even let my staff bring in donuts or anything like that. That's completely banned in my office. So for me to bring in and hide a little piece of cheesecake would be a big thing.
Oh my gosh. Okay. And what would someone be surprised to say that Carmen does what?
Don't know.
Okay.
Not something I would put in the air.
Okay. Oh, it's that bad. It's that bad that she doesn't want to be on the internet. Oh my gosh. Well, folks, there you got it.
That for the man cave session.
That'll be well worth the price of admission, folks. That's right. So, folks, this is Ors, the old guy from www.oldguytalk signing off. If you have not already opted in, what are you waiting for? There is a plethora of advice and stuff that you can use to improve the quality of your life and the life of those that you love. This is Ors, the old guy from www.oldguytalks.com signing off. And remember, it's all about creating a kick-ass life for yourself and those that you love. That's right, those that you love. opt in and encourage other old guy assholes like you to opt in also.